the drums echoing tonight. She hears only whispers of some quiet conversation. She's coming in 12:30 flight. The moonlit wings reflect the stars that guide me towards salvation. I stopped an old man along the way, hoping to find some long forgotten words, oration, melody. He turned to me as if to say, hurry boy, it's waiting down for you. They grow restless, longing for some solitary company. I know that I must do what's right, to sure as Kilimanjaro rises like Olympus above the Serengeti. I seek to cure what's deep inside, frightened of this thing that I've become. Hurry boy, she's waiting down for you.
A land rich in beauty and culture, a continent that rewards the traveler with the spectacle of nature's best. For most people in Africa, life is still simple, but not easy. Death comes early, as diseases that are entirely treatable and preventable are stealing precious years from millions upon millions.
I'm Bazi Kanani, speaking today on behalf of the African Health and Hospital Foundation. I've had the privilege of visiting Africa and of seeing firsthand how this foundation is touching lives.
concern is that these people get the kind of healthcare services they deserve as human beings.
That concern gets translated into these big crates. They're packed with supplies for places like this. Selian Lutheran Hospital in Arusha, Tanzania was at one time considered one of the best hospitals in the entire country, and still.
We are chronically short of the materials, the drugs, the supplies that we need to give the level of care that we're capable of giving.
Dr. Mark Jacobson is executive director of the hospital, which grew tremendously over the years, yet never fast enough.
Particularly in this time of the HIV and AIDS epidemic has put incredible demands on the healthcare systems.
AIDS and malaria, many waterborne diseases, accidents, including lots of firewood burns, cancer. Whatever the illness, this was the best care there was in Arusha. Tens of thousands of people would come to the small hospital each year with one laboratory where tests were all done by hand, and 2 or 3 babies at a time would have to share the only incubator. In Tanzania, as in most of Africa, patients must have patience to get medical attention. A country of 38 million people with only about 2,000 doctors.
So our doctor to patient ratio is about 1 to 19,000 people, compared to most urban areas in the United States where that would be 1 doctor to 300 people.
Remember the crates? These were outside a new hospital being built in Arusha. They were packed by donors and volunteers with the African Health and Hospital Foundation. Millions of dollars in donated equipment and supplies, including something rare in most of Africa, a CT scanner, are now in use here, the brand new hospital that's replaced Selian. What a difference.
Nothing that I have ever done has felt better than this work.
Dr. Jeff Rose and Jill DeSalvo Rose are founders of the African Health and Hospital Foundation.
We hear on the news and see all of the horrible things that have happened in Africa, but Africa is a magical place, and everyone that we have ever spoken with or we have ever traveled with has come back completely changed. If they get a chance to spend some time with the people.
People living in a land rich in beauty and culture, yet desperate for so many of the things we consider standard.
It is easy to get overwhelmed. There's an enormous amount of poverty and an enormous amount of illness, an overwhelming amount of work to do.
Partners and members of the African Health and Hospital Foundation are doing whatever we can.
You have to start somewhere.
Starting today, we hope that you'll join us. Together, we'll do our part to give more fathers, mothers, and children better lives.